Hello classmates, my name is Cynthia Thomas and I will be presenting on child and adolescent mental illness. According to the United States Surgeon General, approximately 20% of United States children under the age of 18 suffer from mental illness. Nearly 5 million children have some type of serious mental illness that significantly interferes with their daily life. Mental illness can result in impaired behavior that ranges from mild impairment to poor performance at school to withdrawing into themselves to self-cutting and worse. Not only are personal relationships with family and friends affected by children with mental disorders, but proper psychological development of the child, performance at school, social integration, self-esteem, and functioning as a well-adjusted adult all depend upon proper mental health care while growing up. Youths with untreated mental illness often end up in the criminal justice system. Nearly 60% of boys and girls involved in state and local juvenile justice systems throughout the country suffer from mental disorders. While some mental disorders may be influenced by genetics, there are major determinants that are not inside a person but in social processes, such as interactions with others. Over the years, there have been a shift in emphasis from treating the individual to treating the family. Social workers, psychologists, and psychiatrists function interchangeably as individual, family, and group therapists. Community Partners is a program that provides services for those families whose child or adolescent may show signs of mental illness. They assist these families by providing social, emotional, and financial support. I had the pleasure of interviewing Wendy Aaron on April 2nd, 2015, who works with Community Partners, an organization that provides both child and family mental health services along with housing and community services. Wendy has worked as a licensed clinical social worker for 6 years within the Parent and Child Center program, which is part of the Child and Family Mental Health Services provided by Community Partners and has been around for over 30 years. Wendy provides social and emotional therapy to children suffering mental illness. Furthermore, she supervises interns and educates case managers on effective practices within the field. The Parent and Child Center accommodates to individuals facing social and emotional adversity, from those in preschool to adults. The target population really encompasses a wide variety of issues, such as children suffering minor issues like separation anxiety to those who have experienced some sort of severe trauma. Many agencies, such as protective investigators from DCF and ChildNet, along with case managers and therapists from schools and daycare centers, often refer clients facing social and emotional difficulties to the Parent and Child Center at Community Partners. Services are then provided in the field based on client preference. More times than often, therapy is conducted within the home, school, or child care center in which the client belongs. The client's needs are determined by working with the children and the referral sources as mentioned before, such as case managers, those that work with the child in schools and daycare centers, and private investigators working in the child welfare system. From there, a treatment plan is developed with input from the child, if they are old enough, and the parent or guardian. Every treatment plan is different in that they are individualized towards the child's needs. Wendy explained that there is no such thing as a typical case and that they are all different and individual. She provided an example of a case in which there was a 7-year-old girl referred to her by a dependency case manager. The girl's mother had a history of substance abuse and her father was incarcerated on and off, and at the time of the girl's services actually ended up going back to jail. The client was living in relative caregiver placement in which a family member provides care. This could be an aunt, uncle, grandmother, etc. The child had been referred because she was developing difficulty with processing feelings and was experiencing separation issues. Depending on the circumstances, Wendy may work with both the child and the family members involved, mostly when the child is reunified with their parents. In this case, the child was not reunified with her mother, unfortunately. A particularly challenging case Wendy experienced was working with a 10-year-old boy who had retained a grade. This case was not presenting any family issues, only the issue of how the boy had previously been diagnosed with attention deficit hyperactivity disorder, or ADHD. ADHD is one of the most common behavioral disturbances in school children, in which hyperactivity and disruptive behavior often occur at the same time. While working with the child, he was not on his medication due to a recent move from out of state. This was challenging because he was showing disruptive behaviors by running all around all over the place and taking off. Furthermore, because Wendy had limited time to meet with him due to school restrictions, she had to meet during lunch. With children moving to and from, it was difficult to get the boy contained and focused. After referring the child to their psychiatrist, he was able to get back on his medication and his behavior improved substantially. Once treatment plans are developed, progress towards goals are reviewed on a regular basis. Wendy utilized a model called Client Directive Outcome Informed. This is provided at each therapy session, in which the client is giving scaling questions. There are 2 scaling sheets, one for children ages 12 and under and those ages 12 and over. At the beginning of the session, the client says how they think they're doing in different areas, and at the end of the session, the client provides feedback on how they felt the session went for them. This information is then entered into a system and provides data and graphs displaying progress made by the individual. The program also uses CFARS, which is Child Functioning Assessment Rating Scales, and FARS, which is the same thing, just an adult version, which are done every 6 months. The CFARS and the FARS help evaluate progress by assessing functioning in different areas. To give you a visual of the client-directed outcome-informed model, here are 2 of the scaling sheets Wendy uses to assess progress. Both are examples of the scaling sheet used at therapy sessions for children ages 12 and under. The one on the left is given at the beginning of the session and asks questions such as, how am I doing? How are things in my family? How am I doing in school? And how is everything going? The scale on the right is used after the session and depicts the patient's feelings towards how the session went regarding listening, importance, what they did, and how it went overall. Success ultimately depends on the circumstances and factors within the case. Some clients with minor issues that may not need treatment for long are discharged successfully. However, Wendy explained that clients who have trauma history may have worked out some issues point in time, but as they get older and change developmentally, traumatic events may impact them differently. Because of this, those clients may need services again, and as she said, many families have intense needs. Wendy mentioned how one of the most challenging aspects of her job is balancing everything. There are many requirements to meet, including a lot of paperwork and a certain amount of time to spend with clients per week, which can be draining. Trying to balance enough time for all your clients is challenging, especially those clients with the difficult circumstances. While the less challenging aspects of social work depends on the therapist, Wendy really enjoys the time she gets to play with her clients. She utilizes play therapy, and because of this, really enjoys working with younger children. She says unlike older kids who have a stigma towards therapy, younger children see therapy as, hey, you're going to play with me today. Through fun activities, she is still able to work towards meeting the child's goals. Although Wendy loves working with younger children, she has worked with all ages. She said some therapists really enjoy working with teens, and it really just varies with whom you ask. Wendy says the most rewarding aspect of her job are the times when cases are successful. She said it's amazing to be able to see the growth in the client from when they first began to the end. One of the major macro issues within Wendy's practice is lack of funding. Although the agency has many funding sources, such as Medicaid, some insurance companies only provide a certain amount of sessions per year. For clients with intense needs, this is very difficult because they simply run out of sessions and their needs are not met. Grant-funded programs also prove to be macro issues because sometimes the funds are not there to grant individuals. There are different reasons why grants may end or decrease for clients. Part of it is to keep up with the funder's requirements. Furthermore, because there is such a diverse population in need of services, some individuals don't meet eligibility requirements for some insurances. There are funders who will cover the expenses, but they are very limited. Community Partners' primary funder is through Medicaid. However, they will also receive funding from Southeast Florida Behavioral Health, which is contracted through DCF, along with temporary aid to needy families funding and grant funding programs. Wendy says there is a reason she has been working with Community Partners for over 6 years, and that is because she believes in their mission. We're here to help change the odds. She also appreciates how many programs are available through the agency and the holistic approach the agency has towards working with clients. Each program within Community Partners measures success differently. However, each program makes sure that they are meeting funders' requirements. Most importantly, all programs assess whether they are achieving the Community Partners' mission and holding up to their values, such as excellence, meeting intended outcomes, and developing relationships that promote trust and dignity. In the field, they tend to use a more evidence-based approach to measuring success. Wendy says what makes Community Partners great is their strong mission and values. Furthermore, they have a passionate group of providers who really care about providing the best quality of services to the clients. She said there is always room for improvement in utilizing better evidence-based practice. This can be challenging in such a large agency composed of 250 employees. After interviewing Wendy and researching the agency, I would absolutely love to work for Community Partners. They seem to withhold strong values that support the values we should obtain as social workers. Furthermore, they provide so many programs to children and families that really seem to meet the needs of just about every population. I found Wendy's work to be very interesting. It seems rewarding to assist children and adolescents with social and emotional issues. She is also able to share her wisdom and experiences, as she is a supervisor for the student internship program for both BSW and MSW students, and also provides clinical supervision to staff. I would certainly consider working in the field of child and adolescent mental illness. I've always felt compassionate towards working with children, and after discovering that there are both minor and severe issues that are associated with mental illness, I am even more intrigued towards the field and would love to aim towards becoming a therapist that works within a child and family mental health services setting. I think that my compassion for others would be very suitable for this field. I tend to be a very accepting person as well, which is helpful when working with those with troubling backgrounds. Furthermore, I have experience working with children who suffer social, emotional, and behavior issues, so that would certainly be useful in the field. One of the difficulties I may face as a social worker in this field is separating work from home. One risk factor is that I may become emotionally attached to some of the children, and the outcomes in certain cases may yield to be unpleasant. However, these are all skills I hope to gain throughout the rest of my education. For more information about Community Partners, please visit their webpage at www.cp/cto.org. I hope you all enjoyed this video and found it informative about the field of child and adolescent mental illnesses and the services that are available.